In this lecture, we are going to discuss structure of the cephalosporins and the productions of the cephalosporins. So let's get started. So as we know that the cephalosporin is basically an antibiotic and it has three most important components. Okay. So first component is actually the dihydrothiazine ring. Okay. That is the first component of the cephalosporin, dihydrothiazine ring. Okay. And second component is actually the beta-lactam ring. Here is the beta-lactam ring. So that's why on the basis of the presence of the beta-lactam in the cephalosporins, we called cephalosporin as beta-lactam antibiotics. And third component is actually the acyl side chain. Acyl side chain. Okay, due to the presence of the acyl group, C double bond O and the R group, that is actually the acyl chain. So here are basically the three most important components of the cephalosporin. So if we give the number to the ring, so that will be the 1, 2, 3, 4, 5, 6, 7 and the 8. So we can give the combined name to both ring as 7-amino cephalosporinic acid nucleus. Okay, if we give the combined name to both ring, that will be the 7-amino cephalosporinic acid nucleus. That will be common in all the generation of the cephalosporin, ceftriaxone, ceftolozane, cefoxitin. So that is the most important component. 7-amino, because at the 7th position you will see the presence of the amino group NH. That is the most important thing. 7-amino cephalosporinic acid nucleus. In the cephalosporin, you will see the changes at 2 position, and ultimately you will see the formations of the new generation. So that position will be the R1 and R2. If you make changes at the R1 position, then it will change the antibacterial activity. That is the most important thing. It will change the antibacterial activity. Okay. And if you make changes at the R2 position, then it will basically change the pharmacokinetic profile of the cephalosporin. That is the most important thing. All the structure of the cephalosporin will remain the same, but the changes will be seen at the R1 position and R2 position in the different generation of the cephalosporin. So it is basically the structure of the cephalosporin. And if we see how cephalosporin is actually produced, or how we can get the cephalosporin. So we get the cephalosporin from the fungi, and that fungi is actually the cephalosporinium. Okay, cephalosporinium is actually the mold through which we get the cephalosporin, or we can also get the cephalosporin through the bacteria. Okay, that is the most important thing. We can also get the cephalosporin from the bacteria, that is the actinomycete Streptomyces. Okay, that is the most important thing. But important thing which you have to remember, that we get this cephalosporin from the bacteria and we use the cephalosporins against the bacteria. That is the quite confusing thing. So important thing, we get the cephalosporin from certain type of the bacteria, and we use the cephalosporins to the different types of the bacteria. That is the important thing which you have to remember about the cephalosporin. Okay. So as we see that the cephalosporin is actually a antibiotic that is used against the bacteria, or you can say cephalosporin is actually a beta-lactam antibiotic due to the presence of the beta-lactam ring. Okay, so here is the bacteria. Okay, so we use the cephalosporins for the destruction of the bacteria. Okay, if we give the cephalosporin for the killing of the bacteria. Okay, but important thing, with the passage of the time, bacteria develop an enzyme that actually destroy the incoming cephalosporin, and that enzyme is actually called the beta-lactamase. Beta-lactamase, that enzyme kill the or destroy the incoming cephalosporin and get resistant from the antibiotic. So now we have to give the beta-lactamase inhibitors along with the antibiotic. So if I say different beta-lactamase inhibitors like the avibactam, tazobactam. So here are basically the different beta-lactamase inhibitors given along with the cephalosporin. So if I say like ceftazidime is actually given along with the avibactam. Okay, so basically avibactam will inactivate the beta-lactamase enzyme, and the ceftazidime kill the bacteria, and its brand name is actually called the avicase. That is the most important thing. In the avicase, we will add both ceftazidime and the avibactam. Okay, similarly, like cephalosporin, we add the tazobactam. Okay, again, that is cephalosporin is actually antibiotic, and tazobactam is actually the beta-lactamase inhibitors, and its brand name is Zerbaxa. That is the major concept behind the antibiotic and the beta-lactamase inhibitor. So this is all about the structure and the production of the cephalosporin. If you still have any question, you may ask in the comment section. Thank you so much.